Good evening, everyone. Welcome to Ujala Cygnus Health Hour. Today's session is particularly important because heart related conditions like heart attack, heart failure, and sudden cardiac death impact millions of lives globally. Understanding the differences and prevention strategies can truly be life saving. My name is Vandana, and I'm honored to be the moderator for this session. We have an insightful discussion lined up today with our esteemed panel of experts who will help us understand these critical heart conditions, how they differ, and what we can do to prevent them. We are privileged to have with us renowned experts in medicine, heart health, and cardiology. Without further ado, please join me in welcoming Dr. Shuchin Bajaj, founder and director, Ujala Cygnus Healthcare, Dr. Sundeep Mishra, chairman, cardiology, Ujala Cygnus Brightstar Hospital, Moradabad. He is professor from AIMS, and Dr. KJ Yadav, senior cardiothoracic and vascular surgeon from Ujala Cygnus Brightstar Hospital, Moradabad. A warm welcome to all the incredible speakers. We are honored to have you all with us. Now, to set the stage for today's discussion, it is my absolute honor to invite Dr. Shuchin Bajaj. Thank you so much, sir, for taking out your time and joining us from Eastern Standard Time Zone. We understand it's too early for you, and thank you so much for being there. The floor is yours to guide us through this crucial conversation. Over to you, sir.
Thank you. Thank you very much, Vandana, and a warm welcome to everyone joining us today on the Ujala Cygnus Health Hour. And thank you very much, Vandana, for starting this wonderful initiative. So, just wanted to reiterate that this is a conversation that has never been more relevant and important than it is now. Over the past few years, we've seen a disturbing rise in sudden cardiac events, not just among the elderly or those with known risk factors, but alarmingly among the youth and alarmingly among the seemingly very healthy individuals who've been exercising or going to the gym. And we've come across tragic stories, young athletes collapsing on the field, professionals in their 30s and 40s suffering fatal cardiac arrests, or even celebrities passing away suddenly with no warning signs. And these incidents have rightfully and wrongfully sparked widespread concern and raised crucial questions. Why is this happening? Are we missing early warning signs? And most importantly, of course, what can we do to prevent it? So I think this is a very, very important initiative that you have started to get this awareness across on how we can prevent it, what we can do, what are the screening tools available to us. Because cardiovascular diseases, after all, remain the leading cause of death worldwide, and India is no exception to it. We are seeing heart disease strike at a much younger age in our population in India compared to the West. And this is all because of sedentary lifestyles, rising stress levels, poor dietary habits, increasing prevalence of diabetes and hypertension, and of course, the very questionable post-COVID. Was it COVID? What was the virus causing? What are the issues which I'm sure we'll discuss today? So today I am hoping that through this discussion with the luminaries of cardiology that we have on the platform today, we will aim to separate the fact from the myth, understand the true risks, and most importantly, discuss how we can take proactive steps to protect ourselves and our loved ones. We have with us some of the most respected voices in cardiology in the entire country today, thankfully. And I really appreciate and express my gratitude to both Professor Mishra and Professor Yadav for sparing their valuable time to come with us and talk about this. And I hope at the end of the webinar, we will know and break down the key differences between heart attack, heart failure, cardiac arrest, and sudden cardiac death, terms that are often used interchangeably but have very, very different implications.
Thank you so much. Thank you so much, Dr. Bajaj. And now I would request Dr. Sandeep to just share his insights and give us a brief presentation on the differences between heart attacks and sudden cardiac conditions. Over to you, sir.
What we will take up today is, heart attack. What is the difference between heart attack, heart failure, and sudden cardiac death? And before that, I think to what Dr. Shuchin was referring, I have some photos with a little bit of story And this guy, KK, 53-year-old, prominent Indian playback singer, and he had a lot of Bollywood songs to his credit. And after a stage show, we remember that he had a sudden collapse. And of course, it was an autopsy was done, and what it relieved was 80% blockage of left main artery. So, this is an example of sudden cardiac arrest. And he witnessed a sudden cardiac arrest because of something which led to blockage of 80% in left main, which was probably because of heart attack. So he had these two conditions. He had heart attack, which led to development of sudden cardiac arrest. So I think this will put the whole thing in perspective. Another person, Siddharth Shukla, an Indian actor, host, at a relatively young age of 40, he suffered heart attack, and he also ultimately went into sudden cardiac arrest, and he could not be revived. So these two guys had something called sudden cardiac arrest, which could not be revived. Another example, this is Michael Jackson, one of the biggest pop stars in the history of the globe. He died in 2009, and he was found in his room not breathing, with almost no pulse, no blood pressure. He was administered CPR, but still unable to survive. So he had something called sudden cardiac arrest, but he did not have heart attack. So basically, this brings out the point that while many times sudden cardiac arrest happens because of heart attack, it is not universal. There are situations where sudden cardiac arrest can happen even without heart attack. Another example, Norwegian competitive swimmer, world champion gold medalist, Alexander Dale Owen, he had a heart attack and led to development of sudden cardiac arrest at the age of 26. And Amit Banerjee, a CEO of Tablespace, also died of heart attack, which probably led to sudden cardiac arrest. So as shown in all these examples, so these are two things that we find, heart attack and cardiac arrest. And while these two can be linked to each other, but they are two separate entities. So basically, what we need to know is that all of them had some problem with the heart, and heart, as we know, can be equated with lifeline. Heart basically is an engine, a pump, which pumps blood, which contains oxygen, to every organ in the body. And every organ in the body requires oxygen and coming through blood for its survival. And therefore, a healthy heart ensures a proper functioning of the entire body. Now, why are we talking so much about heart diseases? So I showed you these examples, all of them dying out of heart diseases. And as a matter of fact, as of today, cardiovascular diseases or cerebrovascular diseases are the leading cause of death globally. And it is estimated that 4 out of 10 deaths are because of heart diseases. Of course, there can be many types of heart diseases. Some of them I already discussed with you. Heart attack, heart failure is another one of them. Sudden cardiac arrest, then stroke. All of them are kind of heart diseases, and they all can be responsible for not only reduced quantity of life, but also reduced quality of life. So, now interesting thing about heart diseases and cerebrovascular diseases is, while a lot of diseases we knew of in past, for example, tuberculosis was caused by single infectious agent. Tuberculosis being caused by Mycobacterium tuberculosis, malaria caused by Plasmodium, and so forth. The infectious diseases caused by a single infectious agent. But interestingly, lifestyle diseases like heart diseases and also stroke, they are not caused by one single etiological agent or one single thing, but they are caused by multiple risk factors. And if the number of risk factors are present, then it is high likelihood of developing that particular lifestyle disease. So for cerebrovascular disease, there are two types of risk factors. Some are modifiable, which means that we can change them with proper lifestyle modification, but some others are non-modifiable. The modifiable risk factors are poor diet, physical inactivity, smoking, excessive alcohol, excessive stress, overweight, lack of sleep, and type A personality. Whereas non-modifiable risk factors are age, of course we cannot modify, and particularly adult male and postmenopausal women, then genetics, then also strong family history, and even some kind of ethnicity. And it is now thought that South Asians are especially prone to develop these cerebrovascular diseases. So therefore, obviously, heart is responsible for a lot of these things if these risk factors are present. But there is also a lot of benefit if we are able to keep our heart healthy. What are the benefits expected? We can have longer life expectancy. We can have improved energy levels. We can have reduced risk of chronic diseases. And most importantly, we can have better quality of life. So that is why, keeping heart healthy is very important. Now, coming to the topic in question, we have these three things which we hear being used interchangeably. And I just gave you an example of heart attack and sudden cardiac death being used interchangeably. But there is another thing called heart failure. So I think at this point of time, we need to understand the key differences between these terms. So what is heart attack? Heart attack is any blockage in blood flow which leads to tissue damage. So basic problem here is that blood supply of the heart gets blocked and gets occluded, and that is why this problem called heart attack happens. So heart attack is essentially an issue of blood circulation of the heart. The second thing that we come across is heart failure, and heart failure commonly refers to chronic pumping inefficiency. Here the muscle is at either weak or is failing. So this is a problem of heart muscle, whereas heart attack was problem of the blood circulation of the heart. But heart failure is problem of heart muscle. But the third problem, that is sudden cardiac arrest, is a problem of electrical or conduction system of the heart. And once electrical system becomes abnormal, there is sudden cessation of heart function, and that can lead to sudden cardiac death. So basically what we see is that heart attack is a sudden event because suddenly heart vessels get blocked. But heart failure develops more slowly because it is weakness of the heart muscle which progressively increases. And on the other hand, sudden cardiac death is rather unexpected event that can happen because of many causes, including heart attack that I already alluded to. So let us look at the structure and function of the heart. What are the structures? So obviously, one structure is the vessels of the heart that I already talked about, the blood supply of the heart. But the other thing is the muscles of the heart, or the muscle that is which is basically responsible for the pump. And there are four group of muscles here: right atrium, left atrium, right ventricle, and left ventricle. And then on the top of that, there is this electrical circulation also. You can see it is being generated from near the right atrium and is circulating. This electrical activity is circulating all through the heart. So basically, what we see is composition of heart is, one is muscle and valves. The second thing is the blood supply to the heart. And the third thing that we see is the electrical activity or electrical conduction system of the heart. And if you look now, three main constituents of heart circulation of the heart, which comes from the big artery called aorta, dividing in leading to left coronary artery and right coronary artery. And then the second part is the heart muscle and the valves. And the third part is the conduction system in the heart, starts from the SA node, internodal pathways, goes to AV node, and finally supplies all the muscles inside the heart. So basically there are three constituents of the heart. One is blood vessel, the second is muscle and valves. Here are the valves. You can see pulmonary valve, tricuspid valve, mitral valve, aortic valve, and then third thing is the conduction system of the heart. And depending on what system is involved, you get a particular disease. So if circulation is involved, then you get something called as heart attack. But if muscle is at problem or valves are at problem, then you get something called heart failure. And if the conduction system of the heart is involved, then you have something called sudden cardiac death. So I thought this will make it very clear for everybody what we are talking about. Now coming to the first thing, that is heart attack, also known as myocardial infarction. Basically, as I said, it comes because of blockage of the blood vessel. Here you can see the blockage happening and basically ultimately blocking the whole artery. So this, once the whole artery gets blocked 100%, you get something called as heart attack. So basically it is because of the heart disease or development of atherosclerosis or fatty disease inside the blood vessels of the heart, and then ultimately forming the clot, and this clot can block. So what is the risk of heart attack? It is estimated that for an adult more than 65 years of age, 1 in 5 men develop heart attacks, and 1 in 6 female develops heart attack. So adult men, 1 in 5, 20% of men develop heart attacks. Very interestingly, half of the heart attacks may present without any symptoms. So many times people come with something called as silent heart attacks, which are there. So 20% will come with silent heart attacks, whereas 50% of the heart attack will happen suddenly without any prior symptom. So half people will have no symptom, they will just present with heart attack. And on the other hand, once heart attack develops, only 80% of them cause symptoms, 20% will have no symptoms. So I think this is important to understand. Now coming to this other problem, which is the heart failure. And heart failure is a situation where the heart is unable to pump blood effectively. And as you can see, once heart is unable to pump blood effectively, the circulation of all the organs, which may include kidney, which may include brain, which may include muscles, all of them get affected. So person is more fatigued, meditation may reduce and may have some kidney problems also, ultimately leading to kidney failure also. So and basically what happens is heart muscle becomes large, it dilates, the heart vessel becomes large, the muscle, you can see here it is enlarging, and this can become more and more, and so there is a dilatation of the heart chamber, it becomes large, we say फैल गया है heart, and pumping efficiency goes down. The causes can be many. It could be because of coronary artery disease, including heart attack. It could be because of high blood pressure, and it could be because of just angina, chronic angina, which leads to this problem of heart failure. Symptoms are basically difficulty in taking breath, fatigue, leg swelling on the legs. You can see these edemas can be because of heart failure. It is estimated that 64 million people worldwide are suffering from this problem, and beyond age of 65, 1 out of 10 adults will develop this problem. So this is as common as 10%. Now coming to the third problem, which is called sudden cardiac death or sudden cardiac arrest. And as I said, because you can see that what happens initially is heart is beating slowly, but then it starts beating faster and ultimately it degenerates and it starts fluttering. And you can see now it has stopped beating. So there is no pumping of blood. And because of this no pumping of blood, the brain will get damaged in about 8-minute time, and other organs will also get damaged, and ultimately person will die. So this is basically an abrupt loss of heart function because of fluttering of the heart, inability to pump effectively. And it happens because of rhythm disturbance. You can see the ECG below. Normal, this is normal ECG, but you see it gets faster, then you starts becoming abnormal. Now ECG is become abnormal. So this is what happens. You can detect on ECG also. What it will cause is sudden collapse, loss of consciousness, and this sudden cardiac death accounts for about 1 in 10 deaths natural deaths worldwide, and 1 in 100 adult more than 75 years of age can develop this sudden cardiac arrest or sudden cardiac death. And I will tell you why we call this sudden cardiac arrest as sudden cardiac death actually, and we will come to that. So just now for the summary of the comparison, as I discussed, heart attack is acute. Symptoms are chest pain, difficulty in taking breath, cause is blocked artery. In adults, nearly 20% of individuals develop this problem. And if no treatment is given, 80% of these people will die within 1 year of development of heart attack. Heart failure, on the other hand, is a chronic or slowly developing problem. It presents with fatigue and swelling of the legs. The real cause is because the heart muscle is weak. The chance of occurring beyond 65 years of age is about 1 in 10 or 10%. And mortality if no treatment is given, or death rate if no treatment is given, is about 50%. The third condition that I discussed was sudden cardiac death. Here, the disease is sudden. We see in those movies, person is hearing some bad report and then suddenly collapses. And that is sudden cardiac arrest. Often there are no symptoms before this problem. The cause is electrical conduction problem, which we call in medical terms arrhythmias. The chance to occur is 1% of population more than 65 years of age. But once it develops, and if no treatment is given, nearly all die. So nearly 100% death rate if no treatment is given for sudden cardiac death. So this is, I think, the summary of this, and I hope it has become clear. Now, what to do? How to manage? So coming to the management by a lay person, everybody can give some first aid. First thing is, as soon as you see a person who is possibly suffering of severe chest pain, sweating, and that kind of thing, you suspect heart attack, immediately call the emergency department. Meanwhile, ask him to chew aspirin, half break aspirin tablet, full tablet into half you swallow, and half you can keep it sublingually or chew it. But important thing is to stay calm, and so that keep the person also calm, and as much at rest as possible. Don't make him move around, because that is very important till the medical attention is got. Now the main thing that has to be done for heart attack at the moment, the gold standard is immediate angioplasty to open up the artery. On the right side, you can see the cartoon, that blocked artery. It was initially, there was a blocked artery. So what it was done was, you can see the block, then the wire was put, a balloon was put, it was dilated, and then this mesh stent is deployed and you come out. So this is the primary angioplasty. That is the best solution in the current moment. But if cath lab or angioplasty facility is not available, then there are certain drugs which can be given, which are second best. So these are clot dissolving drugs. They are not as effective. Angioplasty is effective in 99% of cases. This clot dissolving drug can at most be effective in 60% of cases. But if angioplasty is not available, they can still be given. Of course, after managing, then cardiac rehabilitation is important, and also important to take drugs for a prolonged period of time. Some of the drugs may be given lifelong for two reasons. One is to keep the artery that has been opened permanently opened, and second is to prevent further episodes of heart attack. So some drugs are also given. Initially, a lot of drugs are given. Slowly, less number of drugs are given, but some drugs are given for lifelong. But let us look at, suppose we don't do any treatment for heart attack, immediate mortality is about 50% within 1 hour. Half people die within 1 hour if nothing is done. Then another 50 to 60% in 48 hours. So about 10 to 20% more mortality in next 2 days. In 1 year, about 70 to 80% people die if nothing is done. And the reason for dying would be, again, arrhythmias, which means they will end up into sudden cardiac death, or they may develop heart failure, or they may have cardiogenic shock. Important thing to understand is that the more quickly you give the treatment, the survival chance increases. Every 1 minute delay decreases the survival chance for 10%. And it is ideal that if you can give treatment angioplasty can be done within 30 minutes, practically no damage will happen. If you can do it within 2 hours, very little damage will happen. But if you cannot do within 2 hours, if it is delayed from 2 to 12 hours, some benefit will happen, but some loss will also happen. And beyond 12 hours, the benefit starts decreasing rapidly. Now coming to the heart failure. So we know what is heart failure. It is weakness of the heart muscle, inability to pump enough blood. So what happens is that all the organs that are supplied gets less blood. Kidney can develop kidney failure. Brain may have problems of disorientation, and then other organs also will suffer. Liver will also suffer, and muscles will also suffer. So what do you do? First is, suppose you see a decompensated heart failure, then best thing is that it is better to get the person to sit rather than lie down. Normally for most diseases we make person lie down, but for heart failure it is better to keep him sitting. Then immediately call the emergency services, and there are certain drugs which can be given which can decrease the fluid overload that happens because of back flow of the blood. And so diuretics are the things that can be given, but important to measure pulse, blood pressure before giving anything, and also look at breathing and alertness. What is the treatment? There are many drugs that can improve the function of the heart, that can prevent the other organ damage, and that can actually increase life expectancy. ACE inhibitors, beta blockers, MRAs, and SGLT2 inhibitors. So these are some of the drugs. In some cases where the drugs are not effective, then there are certain other options. For example, implantable cardioverter defibrillator ICD, which is also, again, I will come back to ICD because it's also useful for sudden cardiac arrest. So this is a particular device that is very useful there as well. And there is something called another kind of pacemaker called CRT that can be useful in these patients. Still, if nothing works, then I think heart transplant and ventricular assist devices are the only option. So these are the final therapies for heart failure. Now, what is the mortality of heart failure? If no treatment is given, then in a decompensated heart failure, 30% people will die within 1 month. And if there is a drop in blood pressure also, more than 50% will die within 1 month. But if there is no decompensation, there is no drop in blood pressure, then 1 year mortality rate is around 50% and 5 year mortality rate is around 80%. On the other hand, if it is end stage heart failure, then survival is less than 20%. What is the cause for death here? One is that progressively heart function diminishes. Second is many complications can happen, and one complication is the happening of these arrhythmias or sudden cardiac arrest. So sudden cardiac arrest can also happen because of heart failure. So, progressive heart failure or a worsened heart failure can also lead to sudden cardiac arrest. But besides that, it can also cause kidney failure, liver failure, repeated hospitalizations. And the chance for having sudden cardiac death, that is the third thing, is about 50%. Half the deaths occurred over a lifespan. 80% people die 5 years. Half of them will die with sudden cardiac arrest, and half of them will die with progressive heart damage. So 50% cause of death, progressive heart damage 50%, sudden cardiac arrest 50%. So what is the importance of treatment? Now, without treatment, as you saw, the survival was poor. But if you give treatment, 90% will survive 1 year and 60% will survive 5 years also. So definitely with treatment, something which we call guideline directed medical therapy, there is benefit and there is increased in survival. And therefore early intervention and adherence to treatment. But problem is, because you have to take treatment for maybe lifelong, at least 5 to 10 years, many people stop taking treatment and then they again become at risk of developing these problems, progressive heart failure and sudden cardiac death. But if you can give treatment, I think important thing is to note that 90% people will survive 1 year. So it is very important. Otherwise, it is as bad as cancer. But if you can give treatment, proper treatment, 90% will survive 1 year. Now, coming to the third thing that is in question, that is sudden cardiac arrest. So what do you do once you witness a person? First aid is very important. First is to immediately call the emergency services. Second is something that is called as cardiopulmonary resuscitation. So this is a special type of, you might have seen in movies sometimes, that people use these two hands to pump at the chest. And the pumping or pushing hard and fast at the center of the chest at the rate of 100 to 120 compressions per minute. The other thing is, remember, cardiac arrest is because of damaged electrical activity or abnormal electrical activity. So the other solution is to give a shock. Sometimes you see on the airports and many big places, there are these devices called automatic external defibrillators. So these can be applied as soon as possible, and they are very simple. Once you break open, you take out, there are instructions, voice instructions from the device itself, which tells you what to do. And so you can apply this and you can give shock, which will take care of this abnormal rhythm activity. And so this is the best. Meanwhile, if it is not available, you can also start the CPR. Important thing is that if you cannot administer these two things for 8 minutes, then death will start happening. So there can be a permanent damage which will lead to death. So you have to act within these 8 minutes, golden 8 minutes, to try to revive the patient. Once the patient is revived, of course, advanced cardiac life support is offered by the medical facility. And then after resuscitation, the important thing is to find why this thing is happening. Now, is it because of heart failure? Is it because of heart attack? Or is it because of any other problem? Some other problems can also happen. Some drugs can cause, for example, in case of Michael Jackson, there was like overdose of drugs that caused this sudden cardiac arrest. So many drugs can also cause, and many other things can also cause. Even COVID, there was at that time thought that it can cause sudden cardiac arrest. And many drugs like tricyclic antidepressants, anti-malaria drugs, and also some antibiotics like erythromycin group of antibiotics can cause this particular problem. So identify the cause, and sometimes it can be genetic also, long QT syndrome. Once the problem is identified, you have to treat the problem. If it is heart attack, open up the artery. If it is heart failure, give the strengthening drugs, maybe use ICD, and you can also use CRTD, and then you can stabilize the heart. But if it is because of drugs, then you stop those drugs. If it is because of genetic causes, then you can give this particular device called implantable cardioverter defibrillator, and also some drugs might also help in some cases. So this is the proper thing. But what is the death rate of sudden cardiac death? Very important. If you are unable to treat, then nearly 100% will die. So this is a 100% fatal disease. And if you are unable to give any treatment, all of them will die. And even there is a time frame, as I discussed earlier. If you delay the treatment for 6 to 10 minutes, then permanent damage will happen. The brain damage starts happening at 4 to 6 minutes, and irreversible brain damage happens at around 10 minutes. So anything beyond 8 to 10 minutes can lead to irreversible damage, and person can become dead. On the other hand, per minute, survival declines by 10%. So if you can do within 1 minute this cardiopulmonary resuscitation and AED or implantation cardioverter defibrillator can be given, then if you can give within 1 minute, only 10% will die. But 2 minutes, 20%, 3 minutes, 30 minutes. So that means by 10 minutes, 100% will die. So every 1 minute, 10% are dying. So as early you can start the treatment, the better it is possible to save the patient. So therefore, immediate treatment is important. And as I said, treatment is cardiopulmonary resuscitation, I already told you, and defibrillation. If you are able to give treatment, then the survival can increase up to 70%. So this is one condition. If you don't treat, 100% will die. But if you treat, 70% will survive. Only 30% will die if you can give treatment very early as possible. So I think very important, without immediate treatment, sudden cardiac death is almost always fatal. Immediate rapid response with CPR and defibrillation is critical to improving the survival outcomes. Here, time is life. The early you act, the more life you save. So this is how it is. Now let us come to the second part. Is it possible to prevent heart attack? We talked about what heart attack is. We talked about how to, what are the symptoms of heart attack. We also talked about how do you manage, treat heart attack. But question is, can you prevent heart attack? I think that is the $100 question. And I think what we can do is, there are many ways to prevent heart attack. And if you follow these, we say lifestyle modifications, you can protect heart. So first is adopt a healthy heart diet, which means eating more fruits, vegetable, whole grains, and lean proteins. So if it is a non-vegetarian protein, you use lean proteins, like for example, fish and chicken. Also limit saturated fat. Definite no to trans fat, which is vanaspati ghee and which is reused oil. This contains trans fats. And definitely try to avoid sugars. Include healthy fats like olive oil if you are not frying, nuts and fatty fish. But if you are used to Indian kind of cooking where you have to do some kind of saute, fry, etc., then these three options, oils are good: mustard oil, groundnut oil, rice bran oil. So they are good oils. The other thing is that you need to exercise regularly. After heart attack, there is a staged rehabilitation program which brings you to a 150-minute moderate intensity exercise, which includes brisk walking. But if you are able to do vigorous exercise, then 75 minutes per week of isotonic exercise. Then strength training is also important, and you should undertake 2 times per week. This improves heart health, decreases blood pressure, helps maintain a healthy weight. Then coming to the third point, maintaining healthy weight. Excess weight, especially the abdominal obesity, or can cause risk of heart attack. And so you have to achieve a healthy, which should be neither very lean nor very non-overweight. In between, healthy weight you should achieve. Third thing is, of course, quitting smoking, because smoking damages heart blood vessels, raises blood pressure, and directly reduces oxygen supply in the blood. That's why it is very important to stop smoking, and you can take help for stop smoking as well. Also limit alcohol intake. If you can avoid alcohol, that is best, but if at most 1 drink per day for women and up to 2 drinks per day for men. And excessive drinking raises blood pressure, contributes to heart diseases. Then of course managing stress, because stress can increase the risk of heart attack. Meditation, yoga, deep breathing, regular exercise, hobbies, music, many things can reduce stress. Controlling blood pressure is very important. For that, reduce salt intake, exercise, taking blood pressure medications regularly, and monitoring. Then managing the cholesterol level, that is, the bad cholesterol should be kept less than 100 milligram percent, and good cholesterol as high as possible, more than 45, if possible 60. How you achieve? By a heart healthy diet, exercise, and there are certain drugs also which reduce the bad cholesterol, which can be taken, called statins. Then controlling blood pressure is very important, because blood pressure directly damages the heart blood vessels and increases the risk of heart attack. So if you control blood sugar, then it has a positive impact on the heart health. Also important after a certain age to go for regular health checkups, especially in India, 40 years of male and 50 years of female, or post-menopausal. Once the periods stop, then it is important to go for health checkups, which checks for blood pressure, cholesterol, blood sugar, weight, and body mass index. This is very important because it can help protect heart attacks also. Now, another very important point which is missed many times is the sleep. The quality of sleep and quantity of sleep. I think this is very important. And if this is not happening, then there is a higher risk of heart attacks. And then medications as required. If blood pressure is there, take blood pressure medication. If cholesterol is there, take statins, especially bad cholesterol. If there is high risk for developing heart attacks, you can take aspirin. So all of these can significantly reduce the risk of heart attack. about sudden cardiac death. What I talked about was about heart failure and heart attack. Both can be prevented by the above mentioned things. But sudden cardiac death also, same thing can be done. They also prevent sudden cardiac death, but some special things can also be done to prevent sudden cardiac death. Here, regular heart screenings are very important, especially the executive checkups, blood pressure, cholesterol, etc. Second thing is certain drugs are there which can reduce the risk of sudden cardiac death, beta blockers, anticoagulants, antiarrhythmic drugs. Then this device, as I said, a cardioverter defibrillator, implantable cardioverter defibrillator is also important. And some cases where a lot of blockages are present, before the person develops heart attack and goes into sudden cardiac arrest, a PTCA or bypass surgery can also help. Just telling you some of the warning signs and symptoms that will make you suspect these particular diseases, which I was trying to tell you. For heart attack, the common symptoms are chest pain, shortness of breath, nausea, cold sweat, pain in arm, jaw, and back. What to do? As I said, immediately call emergency, can give aspirin. Heart failure, again, breathlessness, a lot of breathlessness, fatigue, swelling in legs is also very important. Irregular heartbeat and persistent cough. Again, what to do? Obviously, you can call the doctor because that is best. And for sudden cardiac death, the warning signs are chest pain, shortness of breath, dizziness, lightheadedness, palpitations, or irregular heartbeats, and fainting or near fainting. They may not be present in all cases, but as I said, sudden cardiac death can happen because of coronary artery disease, heart attacks, cardiomyopathy, arrhythmias, congenital diseases, high blood pressure, and lifestyle factors, poor lifestyle, smoking, poor diet, lack of exercise, excessive alcohol, and stress. So thank you so much for your kind attention.
Thank you so much, Professor Mishra, for such a wonderful and insightful session. And we have learned a lot today about the key differences between heart conditions and the best ways to prevent them. Now we will open the floor for the question and answers from the participants. Thank you everyone who has already submitted the questions. If you have not yet, please drop them in the question and answer section. So almost several questions you have covered during your presentation. Still a few are unanswered. So the first question goes to Dr. Yadav. So someone is asking that when I can stop medication after surgery. So even after surgery, people have a doubt whether they have to continue medication or they should stop it. So over to you, sir.
First of all, very thanks to Dr. Sundeep for an excellent presentation of the heart disease and heart failure and sudden cardiac death. After CBD, we used to pursue with the medicines. जो कुछ लेना होता है जब बीटा ब्लॉकर statins और diuretics few things. This is just to prevent the re-doses of the anything that happens. इसलिए सारी दवाइयां तो लेनी ही चाहिए लोगों को. हमने कभी किसी को बंद नहीं करके आज तक.
The next question in row, I would like to request Dr. Bajaj to answer this. Do lifestyle changes reduce the risk of worsening heart conditions? So over to you.
I think it is a lifestyle disorder only, except for, as Professor Mishra highlighted, the genetic disorders, where also lifestyle changes will play a part. But of course, as Professor Mishra in his presentation highlighted that we should stop smoking, limit our alcohol intake to less than 1 drink per day for women and maximum of 2 drinks for men, and eat lots of fresh fruits, vegetables, exercise daily. So I think all of these lifestyle factors, including managing your stress, making sure that your mental health is absolutely at the top priority level, all these are very necessary to manage your cardiac disease and make sure that you work on the prevention.
Thank you so much, Dr. Bajaj. The next question is from Dr. Sundeep. what warning signs and red flags which tell you that patient needs to be rushed to the emergency? So over to you.
Yeah. So I think a very important question. I try to answer this, but I will make it more clear. See, there are certain things. If there is a breathlessness which is more than usual and which has suddenly increased, so sudden breathlessness, feeling that you are unable to take a breath as much as required. So I think once that happens, that is one. Second is a severe heaviness in the chest, which was not there before, especially if it happens with exertion. And that heaviness, or it's a feeling like something is pressing on your chest, something heavy is placed on the chest, and that feeling can be radiating to arm, even hands, finger, and neck, jaw, even teeth, even those kind of things. Then this heaviness or a very visceral kind of feeling. So that is one. Third is when there is excessive vomiting and discomfort, feeling that something is wrong and repeated vomitings. Then I think that is another situation where one should think. Then if you notice that suddenly lips become blue, so that is a very important thing, that somebody else can notice that the lips are suddenly very blue, and that is one. Then another one is feeling of dizziness, giddiness, fainting, or loss of consciousness. So any of these, if they are present, then they are also a warning sign that something abnormal is happening. Last, if there is sudden increase and irregularity in pulse rate, suddenly the pulse rate has become very fast and very irregular, then that is again another warning sign that something is there. Last, I would say, if somebody starts coughing and the cough contains some pink color, sputum. So if you see that, it may not be blood, but it's like pinkish in color, kind of expectoration or sputum, then that could be a sign that the person can be in a serious problem. So I think these are the warning signs that one should very carefully think about. And if they are present, then it could be, one of them could be either heart attack, it could be sudden cardiac arrest, or could be decompensated heart failure. So these three conditions can cause these kind of symptoms, and immediate first aid and followed by visit to a emergency department is mandated.
Thank you so much, sir. The next question is for Dr. Yadav. Someone is asking, what dietary and other precautions should you take after the valve surgery? If someone has undergone the valve surgery, what dietary precaution they should take?
Depends क्या valve कौन सा यूज करना है. अगर मैकेनिकल valve यूज करना है, then we have to give acetone or warfarin, which is blood. Prosthetic prosthetic valve, in that case only 3 months acetone or warfarin should be given. Otherwise, from mechanical valve to lifelong, we have to give the acetone or warfarin. And depends on the PT INR care. We give PT INR 2.5 to 3.
Yes, sir. Thank you, sir. The next question is asked.
Yeah, in this
Yes,
case, I think dietary thing is that you need to avoid green leafy vegetables, because that can affect the monitoring, PTINR monitoring, and therefore, you need to avoid taking green leafy vegetables.
Definitely.
पत्तेदार सब्जियां नहीं खानी, हरी पत्ते वाली
नहीं खानी, वो नहीं खानी, मालूम.
Thank you, sir. Kids will be happy to hear this कि उनको green leafy vegetables नहीं खानी है because they always want to get rid of that.
उनकी valve surgery नहीं होती मैम, 15 years पे valve surgery बहुत कम होती है.
Yeah. But now this is statement, they will endorse it and they will ask us, don't give us green leafy vegetable. Doctor साहब ने मना किया है खाने के लिए. Just kidding,
valve
sir.
surgery तो करानी पड़ेगी उससे पहले.
So the next question. Yes,
गाजर भी नहीं खाते, टमाटर भी कम से कम यूज करते हैं, ये सब चीज हम लोग कहते हैं, एडवाइस करते हैं।
अलर्ट वेजिटेबल्स होती है जो कलरफुल होती है, वो अवॉइड करना है। फ्लेवोनॉइड्स होता है ना, वो विटामिन सी, विटामिन के साथ इंटरेक्ट करता है।
Yeah. Thank you so much, sir. And the next one is also from Dr. Yadav, that immediate angioplasty is the treatment of choice for the heart attack, but someone is asking if they can go for bypass surgery, and when is the time that they should go for the CABG? Over to you, sir.
Depends after angiography what comes. Suppose immediate arrest or immediate something happen, then you proceed for the angioplasty. फिर अगर multiple vessels है, multi vessels involvement है, no, that can be referred to for CVD.
Okay. Thank you, sir. So, due to paucity of time, I will take few questions. Someone is asking why heart problems increasing among young people these days. And the next question is, for a seemingly fit individual, are there any signals which are presented days to hours before sudden cardiac arrest? Over to you, Dr. Mishra.
So, this is an interesting question, why it is happening so much now, and especially in the younger population. And I will say that, let us say about 60, 70 years back, nobody knew of heart diseases or heart problems in India. Then what happened was that suddenly people were working very hard in fields, etc. Suddenly they started exercising less, and even for going for shop, they will take the car and go. So the total physical activity suddenly reduced, and that was one reason. There was diet also changed. So previously fats were available less, they were very costly, people could not afford it. But with the entry of Vanaspati ghee, suddenly the very cheaper food oils, especially containing trans fats and saturated fats, were available. So this change in diet was the second thing that happened. And third thing was that stress levels markedly increased with the current lifestyle. And there is also another thing, which is lack of sleep. People are not sleeping enough, so they sleep less. And so these, I think, 4 or 5 lifestyle changes led to the development of heart diseases in Indian population. The second question is that there is this very interesting phenomena that heart diseases, and as a matter of fact, all the lifestyle diseases happen 10 years earlier in Indians. So whereas in America or Caucasian white populations, heart diseases happen after 55 years of age in men, in India it happens at 45 years. Even young people, 20, 30 people get heart attacks, which are very, very rare in West. And I think the reason for that is that especially now some of these young populations are having very bad lifestyle, very high junk food consumption in many people, and then lack of sleep, all night they are partying, and binge drinking. That is another thing that when I was at All India Institute of Medical Sciences, we did a paper where we looked at binge drinking, especially at weekends in these call centers. We found some child, basically 22-year-old, 23-year-old people developing heart attacks. So these were some of the things that happened. This was the first part. The second part was, I think time is over, or what? It's one minute. Second part was, what are the warning signs of sudden cardiac arrest? That is what you asked, no? In sudden cardiac arrest, what are the warning signs that are present? Basically, you have to suspect that this person can develop sudden cardiac arrest if they have some risk factors. What are those risk factors? If somebody has coronary artery disease, coronary heart disease, if somebody has had previous heart attack, if somebody has got heart failure, if somebody has got some genetic, somebody has a family history of heart attack. So if some person died at young age in their family. So these are the risk factors that one needs to look for. And the warning signs are, if somebody develops irregular heart rate, breathing difficulty, or develops dizziness, giddiness, loss of consciousness, then immediately they should seek medical attention, because they can be premonitory signs that person is developing sudden cardiac arrest.
So, sir, you have already covered the answer of the next question that was in the chat box, that what are the screening tests for sudden cardiac arrest? So you have already covered this. Another question is that is very interesting, and that is very related to the common man. What to do if a common man get heart attack in non-medico families? There is no doctor around and someone has got a heart attack. What to do? Over to you, sir.
Basically, first thing is to try to get in touch with a medical team on phone, ask them to come, send an ambulance, something. Even if they are not available, I think inform the medical facility. That is one. Second thing is that you can take aspirin, and aspirin you can break in two parts. Half you can swallow, and half you can keep it below your tongue or even chew. So this way you can take aspirin. The third thing that many people do is they take sorbitrate, start taking sorbitrate because somebody has heart problem nearby. They just take sorbitrate from them, start chewing. That can be very dangerous. If blood pressure is not checked, giving sorbitrate can be dangerous because it can drop the blood pressure. So that is something which you should not do. I think these three things are there. And the third thing that you should do is try to relax the person who has got the heart attack as much as possible. Make him lie down. Make him relax. Don't make him move around. I have seen people having heart attack, driving their own car and coming to the hospital. So they are doing the driving, they are doing all the activity. So the activity is the killer here. So reduce all kind of activity.
Yeah.
Activity, physical activity, everything should be reduced. So this is something that can be done by a common man.
Thank you so much, sir. And thank you so much. We are just in time. And before we wrap up, I would like to thank our incredible speakers, Dr. Shuchin Bajaj, Dr. Sundeep Mishra, and Dr. KG Yadav for sharing their expertise. And also a big thank you to our audience for your engagement and thoughtful questions.